One of the most common applications for the cone beam are implants, and one of the biggest indicators of implant success is bone density. Because of this, we thought it would be valuable to provide a simple refresher on the bone density classifications that are relevant to implant dentistry. The typical classification categories are D1, D2, D3, and D4. D1 is considered the most dense bone with a thick cortical shell. D2 has more porous cortical structure with coarse trabecular bone inside. D3 has thin cortical shell and more finely structured trabecular bone. And D4 is the least dense because it mainly consists of fine trabecular bone. In the theme of implant surgery, a material analog is often associated with each classification. D1 is like oak or maple wood. D2 is like pine or spruce wood. D3 is like balsa wood. And D4 is like styrofoam. Even if you're not a carpenter, this material analogy should give you a sense of the relative stability of an implant in each type of bone. Certain regions of the anatomy tend to show some consistency across patients. The mandible tends to have higher density bone than the maxilla, and the anterior tends to have higher density bone than the posterior. It's worth a comment on a key difference between the mandible and the maxilla when it comes to bone density. Newton's third law of physics states that every action has an equal and opposite reaction. This is true when a patient bites down. The force at any given contact point where the mandible and the maxilla touch, the forces are equal in opposite directions. However, the impact that force has is influenced by the cross-sectional area over which that force is spread, which is defined as the stress that an object feels. The area across which these forces are spread differs between the mandible and the maxilla. The mandible has a smaller cross-section and is sometimes referred to as an absorbing unit, while the maxilla is sometimes referred to as a distributing unit because its larger cross-section protects the eyes and the brain. Because the mandible tends to have a smaller cross-sectional area, it means that forces tend to be more concentrated, which equates to higher stress, the same force over a smaller area. Some correlate this higher stress to the fact that the mandible typically has a higher density bone than the maxilla. More specifically, the anterior mandible tends to be a D1 or D2 type bone. The posterior mandible and the anterior maxilla tend to be D2 or D3 bone, while the posterior maxilla tends to be the least dense of all, usually in the D3 or even D4 classification.